Throughout the 1960s and 1980s, we used to take growth hormone from dead people's pituitary glands after autopsies. You see, before scientists could actually manufacture growth hormone, we decided that it was a good idea to take it from corpses during autopsies. And in the United States, around 7,700 patients received this treatment throughout the 60s and the 80s. And the treatment actually did work. Children did grow, especially if they were underdeveloped, to their actual heights. However, there was one thing that they missed, and that was some of these batches contained things known as prions. Now, to give you a brief explanation of what prions are, they are essentially misfolded proteins within your brain. They typically look like this, something like that. However, prions, the misfolded protein, makes other proteins just like them, and that's something that you don't want. That's a no-no. You really don't want that. Now, once this happens to you, it causes you to have a disease known as Creutzfeldt-Jakob disease. And unfortunately, this disease is incurable and fatal. And the worst part about this that we are seeing now is that symptoms can be delayed for decades. In 2025, researchers documented a woman who began to have balance problems, and lo and behold, she did receive these growth hormones from these cadavers as a child. Now, very unfortunately for her, she passed away about 4 months after experiencing the first symptoms. The program did stop distributing these hormones in 1985. However, that's only about 41 years ago. However, cases continue to appear because of that delay. Now, thankfully, modern growth hormones are manufactured through recombinant DNA, so there is no risk of these prions. So, thankfully, no one has to rely on a morgue to supply growth hormones anymore. So, yeah. Oh, also, you might be wondering, why is it so difficult to cure this disease? I mean, it's just proteins. Why can't we just do something about them? There's a few factors. One being that they have no RNA or DNA, which makes it very difficult to use antiviral or antibacterial medication that we already have. Secondly, they're very resistant to high temperatures or radioactivity, so again, a little bit hard. And lastly, we would need to have medication that can pass the blood-brain barrier, which protects the brain. And unfortunately, that is kind of difficult to do. So yeah, hopefully one day we find something for it, but until then, it is very unfortunate.